I'm Dr. Shilpa, consultant orthodontist. We're going to discuss about the case that we just saw. So when a 13 or a 14-year-old patient walks in wanting to get aligners or braces because they think that their front teeth are irregularly placed, when you start doing a clinical examination and you realize that the patient's milk teeth haven't even fallen off yet, and then you take an OPG and then you realize that the permanent canines are still impacted and milk teeth are what are in the position of the permanent teeth, we have to intervene. 13, 14 years is good enough for us to intervene, remove the milk teeth first and bring the permanent canines into place. But in the case that we just saw, you could see that the permanent canines were angulated and we don't even know if they are towards the lip, buccally placed, or towards the roof of the mouth, palatally placed. And the lower part of the x-ray also, if you notice, there is a canine that is sleeping in the bone, literally. That's called a transpositioned canine, where the left lower canine is completely fallen flat along the jaw line, the border of the lower jaw, and it's still entrapped within the bone. And the lower incisors cannot be moved with that canine sleeping there like that. And the primary tooth needs to be removed, and the permanent canine needs to be surgically removed before I even start the braces for the lower. So before we start any of this, I need to be clear as to where the canines are placed really within the bone. So first we ask for a CBCT so that I can get a clearer, more 3D accurate location of where the canines are placed, and the upper canines, if they're even favorable for me to bring them down into their desired position. Because in the process of bringing the upper canines into the desired position or the final position, let's say I end up destroying or affecting the root of the lateral incisor, that means the lateral incisor is now compromised and it has to continue to go for root canal. If not now, eventually the patient will end up with sensitivity or pain. So the lateral incisor ends up going for root canal and a crown. So kind of complicated, not so complicated, but it's going to be a time-taking process. So it involves a lot of patient counseling, sitting and explaining to the patient what happens if you don't intervene now, what happens if you do intervene now, and what are the advantages and disadvantages of going for braces. And such patients are completely contraindicated for aligners, because clear aligners are definitely not going to give you the final position. It's a very risky, very long process with braces itself. So imagine going for such cases with aligners. It could take years to actually bring them down. Let us see once we get the CBCT and we actually correlate the CBCT clinically with the photos, with the OPG, and then we'll take a call as to how to go about the case. Most of the patients, unless they actually have their front teeth malaligned or irregularly placed, don't really come to an orthodontist to get any alignment done. And half of these patients don't even know, they don't even realize that their permanent teeth are not out yet, their primary teeth are still in position, they haven't shed yet. And only when they come here, we check, we take an OPG and we explain to them, we show it, and then that's when they come to know that, okay, so the 32 teeth the 2 teeth are still stuck inside, and these primary teeth that should have fallen off 2 years ago, 3 years ago, haven't exfoliated yet. So let's say the patient has never been aware of this, never came to you. What's the worst that could happen? The canines inside are going to try and want to come out. So they're going to keep going in the angulation that they're already present. They're not going to upright by themselves. And in the process, they're going to start hitting the root of your adjacent teeth. So the patient is eventually going to come to you, maybe not now, maybe in 2 years or 3 years, because they have sensitivity when they bite with their front teeth. Most of the times, a lot of patients don't really know that one of their permanent teeth hasn't even come out. It's still stuck inside. So in such cases, we have to be quite careful when we're actually intervening, and the patient has to be completely aware of what we're going to do, starting from the first step to the last step. And if at all we don't treat such cases, you're going to end up compromising the healthy teeth, right? So a tooth that is completely sleeping, even if we tell you to let it be, it's just a matter of time before it starts impinging on some nerve, some tooth, and then you end up with pain or sensitivity, and you come back to us and we do root canal treatment for 2 or 3 teeth, and then we give you crowns, we give you bridge, all of that. So is it better to treat it as soon as you catch it? Definitely yes. What happens if you don't? You're going to end up compromising a few other healthy teeth because of these.